Malaria is one of the most prevalent so-called tropical diseases in the world, from Latin America, Africa, and Southeast Asia. Malaria comes from a parasite, not a virus. We discussed dengue a few days ago. Dengue is a virus. Malaria is from a parasite, which is called Plasmodium. And you have different strains of Plasmodium, the same you have different strains of dengue virus, if you remember.
Yes.
For dengue, we say 1, 2, 3, 4, but for Plasmodium, they have different names. So the two main prevalent are Plasmodium falciparum and Plasmodium vivax. The most important one is Plasmodium falciparum because it's the one who can kill humans. Vivax can be severe. The inconvenience of Vivax, it can be resistance and people can keep the parasite for some times. It can be kind of not really chronic, but if they don't get the proper treatment, they may have future access of malaria in the future.
Okay.
For falciparum, it doesn't last long, but there's a very severe forms which can trigger life-threatening conditions. And falciparum and vivax are both available in Thailand.
Okay.
Not too many cases in Thailand. Again, we make some parallel with dengue. Dengue can happen in urban area.
Okay.
You can have dengue in Bangkok,
Yes.
even center of Bangkok. Okay. You can have dengue also in the province. Malaria, you will get it not in the center of Bangkok. Practically 0 case. Countryside, even more so, the forested area close to the border with Laos, Cambodia, Myanmar.
Okay.
Here you have some permanent kind of endemic of malaria, and there are few cases which happen regularly. But for expatriates, long-time expatriates living in Bangkok or main cities, Chiang Mai, Phuket, it's very rare to have malaria. But it's not exceptional, you can still have it. A specific disease, specific vector.
Okay.
So for dengue, it's called Aedes aegypti, the one with a white stripe, stripe you can easily recognize. And this mosquito can bite mainly during daytime.
Okay.
Also during evening time, but it's mainly during day.
When the sun is out.
Yeah. For malaria, the mosquito is called Anopheles, and this mainly bites during late evening or night. A bit like dengue, it starts like flu-like symptoms.
Okay.
So, but dengue, as I told you, it's a very sudden symptoms. You get really very important malaise, headache, chills, you don't feel comfortable at all. What is typically, you can see they work as a team.
Yeah.
During throughout the 24 hours, you can get either dengue or malaria, especially in the province. Both are present. Malaria can start also like this, by flu-like symptoms, headache. What will be more characteristic is chills. And high fever also. Vomiting and diarrhea can also happen. And typically for malaria, this kind of malaria access can last about 4 to 6 hours and then practically disappear. And then the next 2 to 3 days, 4 days, it happen again. So if you have a cycle of this kind of feverish symptomatology, it looks like flu, but especially with chills and diarrhea, headache also, happening at different interval of 3 to 4 days, that would be very suggestive of malaria. Since we are talking about travelers.
Yes.
Travelers should be aware that it's difficult to make diagnosis only on the symptoms.
Mm-hmm.
So it can be dengue, it can be a flu, A or B, or it can be malaria. So in all 3 cases, we don't feel so good and they are too far from, let's say, a good hospital. They have to think about going back to some places where they can have a good treatment if needed. And also in the area where you have nice archaeological spots like Luang Prabang.
Luang Prabang, yes.
Because Luang Prabang around you have forest.
Yes.
Not so far. Same story, you have forest around. Pagan in Myanmar.
Yeah.
So even Borobudur in Indonesia. So these places, they are not really inside the city, rather inside the forest. So when they visit this place, they have to be aware of malaria. One very important point which I would like to raise. You have incubation period. Incubation period is when you start being infected and when you start to have the symptoms. You are bitten by the mosquito now, you can still go home tonight without any symptoms, both for dengue and malaria. Okay? Incubation for malaria varies depending on the strain. For falciparum is about 1 to 2 weeks. And that is very important for a traveler because, including dengue actually, they get 1 week vacation. They do 5 days trekking, they move around, get malaria, still fine, take a flight, go home, and they may go home to a country free of malaria. And doctors will not think about that. They will come back and say, oh, you have a flu now, probably a big flu. So get this medicine, maybe Tamiflu or other supporting treatment, but they will not think about malaria. So what is very important for the people, the travelers, when they go back to their respective country, is true also for dengue. If they suffer from something which looks like a flu, don't think only about flu. It may be a flu, which you can catch sometimes in the plane, but it can be also malaria, which you imported back to your country. You have to tell your doctor, and you have to insist to the doctor, I've been traveling, I went to Indonesia, I went to Thailand. On top of that, I was trekking in some area, but he has to insist because we have one case in the insurance where one of our members went back to the US, which is a malaria-free country, and he has a very severe, actually, malaria access, and the doctor did not diagnose him initially. After only 4 or 5 days, he was already going to a very severe, even life-threatening malaria, and actually, interestingly, he called us, and I was telling him, oh my God, you have to tell them that he was already telling the people because he was not stupid. He knew that he could have catch malaria. But the doctor insisted, no, it's just a flu. Go back to your hotel. So I insisted to him, you go back to the hospitals and you insist that you came back from a country where malaria is endemic. And then at that time, they decided to do a simple diagnosis test and they diagnosed malaria. That's very easy. But you have to go to a place. Do not need to be in very sophisticated place. Just to get a little drop of blood, put under the microscope, we call it a blood smear. Just put it like this. Look at the microscope. It takes 10 minutes to see the parasites which are actually inside the red blood cell. It's very visible to see. And that is a confirmed diagnosis, 100% confirmed. Plasmodium falciparum can induce severe complications, especially in young children. Again, for dengue, remember, below 4 years old is a risk also for them. Same for malaria. Young children are more affected. We are thinking about 100,000 dying every year throughout different continents. It's a serious disease. Malaria will basically, the parasites will invade the red blood cell. And they will multiply in big quantity. And what happens is often the parasite will go to all of a sudden to many red blood cells and will burst because of full maturation and multiplication, will burst the red blood cell at the same time. So that will create all the symptoms, high fever and chills and things like this. And this parasite will again colonize all the red blood cells. And if it's not treated, it's continue like this cycle, like this, about 1 to 2, 3 days. Every time to penetrate a red blood cell, multiply inside, and burst the cell, go to another. And sometimes so many red blood cells will be parasites. 1, 2, 3, 7, 10% of parasites of red blood cell can be parasites, fully occupied by this Plasmodium falciparum. And that will clog the arteries in many organs, so they can have a kidney failure, liver failure, and the worst will be what we call cerebral malaria, the brain malaria, because a lot of clot process will happen in the brain because there will be so many red blood cells which will be destroyed and making a kind of mass of parasites blocking the arteries of the brain. That is extremely serious. It's a life-threatening condition. It has to be treated very energetically. And of course, at this stage, hopefully people should not wait for this stage. But at this stage, they will need supporting treatments, ICU, and etc. Luckily, there is a good treatment, which is not expensive here in Thailand. It's based from a plant, which is also from the traditional Chinese medicine, which is artemisinin type of medication. IV form is artesunate, which is available here. It's not too expensive. It is intravenous. In 2 days, all the parasites will be destroyed. But for those who have a very serious conditions, for instance, they went into liver failure or kidney injury, serious kidney injury, so there will be probably time to recover all of this. In general, no, people are treated most of the time on time, and then there is not so much long-term complications. They will use this kind of medication, I told you. If it's a very minor symptoms, they can use the oral form. These products are derived from quinine. Quinine is a substance also coming from the herbs, and it will kill the parasite. But some of these products will not completely eliminate the parasite. So the parasite will hide somewhere, probably in the liver, and then can create another episode of malaria in the future, especially for the Plasmodium vivax. But vivax, as I told you, is usually not life-threatening. For falciparum, normally, when it is treated, it doesn't last long in the blood later on. And if there is any serious condition, then they will use artesunate. Artesunate intravenously, then about 1 or 2 days treatment, and then the parasite will be gone forever. Yes. So here is interesting also to consider two types of person. The travelers. They come here in the region. It is an endemic of malaria. So it is worse in that case to take prophylaxis. 1 to 2, 3 weeks vacation here. That's fine. It's enough. We are not going to get the long-term side effects of products related to quinine, which means medication to prevent to have the disease. Okay. And the very common one are products like Nivaquine, Flavoquine, which are extracted from quinine, which you have to take every day, 1 pill. You take few days before leaving, and after coming back, you take still 1 or 2 weeks after coming back. Okay? So that is worse to do it if you do it for, let's say, 1 to 2, 3 weeks vacation here. That's fine. It's enough. We are not going to get the long-term side effects of products related to quinine, which have few side effects. Okay? So for travel, yes. The best is to have a consultation with a travel medicine specialist. This is a specialty. These people know exactly on a real time when are the most endemic area, because malaria also has different incidents during the year. When there's a rainy season, more mosquitoes. So these people, the specialists will advise, oh, you go to this place. Currently, I heard there is an epidemic ongoing. So definitely you have to take it. But in case it comes to another period of the year, or you come to the same place, now there is no more, very, very rare. So consultation with travel medicine specialists will be worse for people coming here in Asia, if they want, especially if they want to go in a forested area and traveling far from the main cities. But if they come only to Bangkok, no problem. Okay, besides prophylaxis with this medication, you have to try to avoid as much as possible, same as dengue, to be bitten by mosquitoes. So if you go in the forest, you have to sleep. Sometimes you have to sleep in the forest. That's risky. You need to have a special bed surrounded with mosquito nets. Okay, that's very important to protect you from mosquitoes. You are going still to have some mosquito bites, but you have to limit. If you get only 1 or 2 instead of 50, different.
Yeah.
Okay. So that's the same. And you can take mosquito repellents also. Same story as dengue.
Yes.
Okay. Now for vaccine, there are 2 vaccines which are not totally exciting because the efficacy is limited to about 30%, better than nothing. It's only indicated for children at the moment because they are higher risk and higher risk of severe malaria. So children, including the endemic area, could get advantage of the vaccine, but there is still ongoing because 30% efficacy is not above the threshold of WHO for saying that the vaccine is effective. So that is a little bit effective, so it can be considered, but it's not indicated for adult traveling. Okay, so for adult at the moment, the travelers, they don't need to, there is no vaccine to take. Just take chemoprophylaxis with Nivaquine, Flavoquine, knowing also the fact that this product, whatever the product you will receive from your GP or from a travel specialist, it's not a guarantee that you will not get a malaria because there are resistance to this medication for so many years now. So again, what is very important, if you come back home, especially if you live in a malaria-free country, you have to tell the doctor that, oh, now I have all the symptoms, looks like a flu, but maybe it's malaria or dengue. We have access, they can call us here. So we have 4 doctors and we work also on Sundays, Saturdays. During nighttime, we have a service to answer also their calls, but we are going to respond in the early morning in that case. We will advise them based on the symptoms they have or based on their questions where to go if there are some concern about having caught a specific disease, especially tropical disease. So, of course, we can provide also the place to go. We can liaise with the doctor in this hospital. They can also give us what kind of medicine they take. If they are otherwise healthy, so it's okay. And most of the time, no so much concern with both dengue and malaria, actually. But if they have underlying conditions like previous pulmonary problem, cardiac problem, or immunodepressive problem, for instance, in that case, it's worth to call us and we'll advise where to go. In some cases, there will be on and off episode of malaria with lasting 4 to 6 hours, having a headache, chilling, not feeling good at all, malaise, vomiting, sometimes diarrhea, then disappear and you are quiet for 2 or 3 days. Yeah. Then one more happening again. That is very suggestive of malaria. But even for dengue, it's true that typically you have this petechiae coming or bleeding, and you don't have that in malaria.
Okay.
It's true that if you have all these symptoms, typical symptoms, normally people will already suggest a diagnosis without additional tests. It's not always easy. Most of the people do not have all the typical symptoms.
Yes.
So often, beside the clinical examination, of course, which is very important, then some tests may have to be done. There is a suspicion of either malaria or dengue.